Hospitals treat a variety of medical conditions, but one condition that is being prioritized is daily needs. Everyone deserves access to high-quality medical care, but also access to nutritious food, medicines, shelter, and being able to live in a safe and healthy environment. Today, we are joined by Marlow Levy, the president of Mercy Fitzgerald and St. Francis Hospitals, who will spotlight many of the things these two hospitals are doing to address health equity in Delaware County and Northern Delaware. Thank you so much for joining me today. I really look forward to getting to know you a little bit better and hear about your passion. We'll get us started with that first question for health equity.
Yeah. I've been doing this about 30 years. And so to me, just coming in the field of healthcare is really about service, right? And just based on my time in the military, based on where I grew up in the city down in Tampa, Florida, I was always surrounded by folks that required healthcare, right? And so I think I really developed that passion early in my career. And so now I get the opportunity as a healthcare leader to really have a positive impact on those kinds of things like health equity in the communities that we serve. And so it really is a privilege to do this work. And so I don't feel like every morning I wake up really going to the job, right? I wake up every morning with a mission to really have an impact on our communities. And so it almost is something anybody could be passionate about, right? Because you really do feel like you're doing something every day to impact someone's life, even if it's a small thing, like partnering in the community.
Yeah, that's amazing. And like you said, it's just maybe if it's one small thing, meeting somebody where they are, it impacts the whole community.
That's exactly right. That's exactly right. And so being that the two communities that we are in Darby and with our Mercy Fitzgerald Hospital and then our St. Francis Hospital, they really are true community hospitals, right? Where the mission of the Mercy nuns that came here, as well as the St. Francis nun, was really about bringing healthcare to a community that really needed it, no matter what, right? No matter what your resources are, you do the best you can with those resources. And that's what we do in our community every day.
That's amazing. Yeah, I've had the opportunity to interview some of your colleagues. And one thing that's always struck me and that I think you're particularly focused on is meeting the individual where they are. Could you tell me a little bit more about some of those initiatives, like to meet people where they are?
Absolutely. There are a few of them at both of our campuses, being that both of our campuses are a little bit different just in the services that they provide, but the mission is the same. And so we know that in both communities, and certainly in the Darby community, healthcare disparities are prevalent in those communities, right? We understand that, especially like in Darby, with the population that we have there, we have a higher rate of infant mortality in that community, right? We have a higher rate of maternal complications in that community, as well as chronic diseases like hypertension and diabetes. And we have an actual higher rate of admissions to our hospital for these preventative diseases. And so coming in with that kind of a mindset and understanding that many of those patients also come through our emergency department, it really is imperative that we try to meet those patients in the community where they need the help, understanding how we can help them learn about preventive measures so they don't end up in our emergency rooms, right? And so we do a lot of things around how do we connect with community partners, whether it's in Darby or Wilmington, to bring them into the planning of how we take care of the patients in that community, or bring them actually in the hospital if they're a not-for-profit and actually acquire spaces in some of our hospitals to help our community out, right? We are currently looking at a couple of partners around behavioral health and trying to figure out, okay, how do we partner with these not-for-profits in the community that already have connections to patients in the community, right? As well as bring them into the hospital where they're closer to the healthcare that they need. So it really is a win-win for the community in these partnerships, as well as for the hospital in terms of our ability to connect with patients.
Absolutely. I love that you, of course, will treat them when they are in your emergency room, but you all are trying to keep them out of the emergency room, just in a healthier community in general. Could you Tell me a little bit more about these specific programs, the Health Equity Center, and I believe it's Healthy Village. Oh,
Great
okay.
question. Thank you for bringing that up. So at our hospital in St. Francis in Wilmington, we began a couple of years ago working with community partners to develop what we call a Healthy Village. And it really is a very unique concept in terms of for that community, where we partner with not-for-profits in the community that have complementary services to the healthcare organization in St. Francis, in particular. Things like substance use, right, is one of those ones.
Right.
Even in that area and community in St. Francis is a needed service in that community. And so behavioral health is another one of those that we need. The Health Equity Center is a great example of how we partnered with a not-for-profit to develop a place where folks can come and get things for free, right, without paying, right? Because we know that the income disparity is also an issue in lower income communities. And so they have things, everything from childcare seats and childcare equipment to food products in some of our food bank areas and and the great thing about the Health Equity Center is it not only can serve the community, but it also can serve the people that work at our hospital that live in the community that also have challenges as well. It's almost like you walk into a little mini Walgreens or something. You walk in there, right? And the great thing is the staff there are so connected to the patients that the experience that you get is really as if you really are walking into a retail store. You're just not paying for it when you walk out, right?
Oh, I love that.
Giving you that feeling that it's not, like if you're going into a thrift store somewhere, you're just
Right.
getting a bag handed to you. You're going in there, you're shopping as if you're in a real store.
with
You're getting
dignity.
that with dignity. That's a very great way to put it, right?
I love
Shopping
that.
with dignity, right? And it's very powerful.
Yes, yeah. Like
that's
what
a
you've been
very-
talking about behavioral health. It's like the way a person feels is also going to affect their physical health.
That's exactly right.
Yeah.
So I'm a nurse by trade, and a lot of times we utilize Maslow's hierarchy of needs, right? And we understand that in that hierarchy of needs, safety, security, belonging, all those things are the very basic things you need in order to thrive, right? And so when we think about things, what the Healthy Village is doing and what this Health Equity Center is doing and what we're doing in Darby, we are really trying to meet that person at that level that they need to build a foundation to thrive, right? Just helping them take care of those basic lower level needs for Maslow's hierarchy where they can thrive and be successful. And it's amazing to watch. And we have amazing teams that do this every day with our patients and make those connections. So it's phenomenal.
It's so inspiring. I know I can just hear your passion in your voice. I really appreciate it. And I know the community appreciates you and both your hospitals. Do you want to, in closing, just tell me more about your vision for the future, like how you'll continue to prioritize?
Absolutely. We continue to work with partners. We continue to look for ways to continue to grow with the Healthy Village as well. We have a number of partners still slated to open up in that hospital. And so we're going to do a full renovation of the bottom floor.
Oh, wow.
And so I'm excited with what that's going to look like for our community to be able to walk in there and not feel like they're in a hospital, but feel like they're in a place where they can come and commune and they can get the services they need, as well as just in case they need the healthcare. And it really is a great concept that I'm looking forward for that continuing to grow. And potentially it becomes something we can scale or at another facility, right? In Darby, I'm looking forward to continuing partnerships with the community around behavioral health and around substance abuse and growing that piece of services that we don't necessarily have at the hospital. We're also looking to partner more with community organizations, right? So as I'm learning the community, getting out in the environment, meeting community leaders, working together to figure out how do we really have an impact on healthcare disparities in these two communities, right? If we could move the needle just a little bit in terms of healthcare disparities, then we've done our job as a community hospital, right? We really have impacted that community and brought them to a place where they're able to thrive a little bit better. And so that's my vision, right? To walk out in that community and see people that I know and say hello to those folks walking up and down the street healthy because of the care they received at either St. Francis or Mercy Fitz, or because of the services they were able to get through the Healthy Village or through some community partnership that we have at Darby.
Oh, I love it. I'm so inspired just meeting them where they are. And like you said, your passion is really coming through in this interview. And I so appreciate your time.
Absolutely.
Thank you.
Thank you.
Trinity Health Mid-Atlantic remains committed to treating the whole person, not just their medical conditions. To learn more about the community resources and some of the programs and services Marlow shared with us today, visit the link in the description below. Thank you for joining us today, and make sure to hit the subscribe button to get new episodes of Beyond the Stethoscope every other Thursday.